Good evening. I'm Kiki Jameson, president of the Fund for New Jersey. On behalf of the fund and our 24 co-sponsor partners, thank you for joining us tonight for the 5th installment of Imagine More, Racial Justice Begins With Us. Ensuring Health for All is an event that brings together many of the themes we've already discussed throughout our series. And while we're heartened that the Black maternal health crisis is gaining more attention in recent months, we also must recognize that much more needs to be done, including spotlighting the impact of environmental injustice and climate change on New Jersey's communities of color. We're fortunate to have these experts joining us tonight to do just that and more. Tonight, our goal is to offer some hope and pathways to change in these difficult times. Imagine More is a first of its kind 6-part series of events that brings together national thought leaders, philanthropic and community-based organizations, academic institutions, healthcare leaders, policy advocates, jurists, and local activists from across the ideological spectrum, united around a common purpose: advancing racial justice and repairing the harmful impacts of systemic racism. Throughout this series, you have heard and will hear from change makers who offer action plans for making concrete changes in wealth distribution, criminal justice, housing, education, health, and political power. And although each session focuses on a different topic, we recognize that all of the topics are interconnected. That is why our speakers will also propose solutions to repair the harm created by all of these injustices. Additionally, following each event, you will receive resources and information to connect you with the organizations doing this important work and to guide you in leading change in your communities. We launched Imagine More in February, and we're enormously proud that nearly 1,200 people from across the state have registered for our series, demonstrating that not only do they understand the urgent need to address racial injustice, but that they also want to help. Tonight, we're challenging New Jersey to ensure health for all, especially those who've been historically denied or ignored. So welcome to our 5th event, Ensuring Health for All. We're delighted to start by presenting Dr. Denise V. Rogers, Vice Chancellor for Interprofessional Programs at Rutgers Biomedical and Health Sciences. Dr. Rogers will help us to understand the current reality surrounding New Jersey's health disparities and what can be done to repair the harms caused by structural racism. Dr. Rogers will then be joined by Micheline Davis, Esquire, who is President and CEO of National Medical Fellowships, and we're delighted she is also a board member of the Fund for New Jersey. Micheline will moderate tonight's interactive discussion with the speakers and will include questions from you, the audience. And now, it's my pleasure to welcome Dr. Rogers.
Thanks, Kiki, for that kind introduction. And I will start by actually sharing my screen so that I can put together, show you all my slides. So one of the things that I am hoping to do this evening is to very quickly give you an overview of some of the major health challenges that we have related to disparity in New Jersey. I'm going to talk about the facts of disparity. I'm going to talk about some of the causes of disparity and some strategies that we might be able to use to eliminate these disparities. I want to take a step backwards, though, and remind us what health, the definition of health is. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I also want to remind us that health disparities are preventable differences, and they are differences that are largely due to social determinants of health. And I want to remind us that these are not disparities due to race, these are disparities due to racism. Sir Austin Bradford Hill reminds us that health statistics represent people with the tears wiped off, and I tend to show this slide before I run through slides with a lot of data, and that's what I'm going to show you right now. So we look in the state of New Jersey, we see that African Americans have the lowest life expectancy at 72.2 years. We also see that the average age of death by race ethnicity in New Jersey is 68.1 years for African Americans and 67.1 years for Hispanics, compared to 77.6 years for whites. We also see that African Americans, represented in the yellow line on top, have the highest age-adjusted death rates and have had the highest age-adjusted death rates in New Jersey for the past 20 years. We know all too well that African American infants are significantly more likely to die than their white, Hispanic, and Asian counterparts. And again, we see, looking at the yellow line, that this has been the trend for 20 years or more. This has probably actually been the trend for over a century. Continuing to look at the yellow line, we see that African American children ages 1 to 4 are significantly more likely to die than their white and Hispanic counterparts. We see the children, Black children ages 5 to 14 are significantly more likely to die than their white and Hispanic and Asian counterparts. And we see that adolescents and young adults ages 15 to 24 who are African American are significantly more likely to die, as are adults, Black adults ages 25 to 44, African American adults ages 45 to 64, and African American adults ages 65 to 84. If we look at the top 10 causes of death in New Jersey in 2020, we see that African Americans are disproportionately more likely to die in greater numbers and at disproportionately younger ages for 8 of the 10 leading causes of death. And I will note on this slide that COVID-19 in 2020 was the second leading cause of death in the state of New Jersey. What we see here is that on an age-adjusted basis, that Hispanic and African Americans are more likely to be infected with COVID, they are more likely to be hospitalized, and they're more likely to die in the state of New Jersey. What are the causes of some of these disparities? Largely social determinants of health, as I mentioned before. I don't have time to go through all of them, but this is what social determinants of health are. What we also see, if we look specifically at one of these social determinants, education, is that the odds of death decrease substantially just by graduating from high school. And obviously, the odds of death decrease even further with greater years of education. What we also see in terms of social determinants is that the richest American men live 15 years longer than the poorest men. This is regardless of race, while the richest American women live 10 years longer than the poorest women. If we look at the wealth gap, we see that there's a significant difference in wealth between whites, Blacks, and Hispanics throughout the United States, but the gap is even greater in the state of New Jersey. One of the leading contributors to wealth is home ownership. And if we look at the data for every county in the state of New Jersey, we see that African Americans are significantly less likely to own their homes when compared to whites. What we also see are pockets of increased poverty in the state of New Jersey. So if we look at Newark, where I'm based and work, we see that the median household income is about $37,000 compared to $85,000 median household income for the state as a whole. 1 in 4 people living in Newark live in poverty compared to 1 in 10 people living in the state as a whole. What's even more tragic is that 25% of Black children and 23% of Hispanic children, Latino children, live in poverty, compared to 4% of Asian children and 11% of white children. We should, however, find all of this data to be unacceptable, as no children should be living in poverty. So what are some things that we can do to remedy this? Well, as is the theme of this evening's presentation, we need to ensure that everyone has access to high-quality health care. What we also need to do is eliminate poverty. As Robert Kennedy said, As long as there is plenty, poverty is evil, and certainly there is a lot of plenty in this country, so there is obviously a concurrent amount of evil. And lastly, of course, as Maya Angelou reminds us, we must eliminate racism. As she says, the plague of racism is insidious, entering into our minds as smoothly and quietly and invisibly as floating airborne microbes enter into our bodies to find lifelong purchase in our bloodstreams. These are some of the most important things that we can do moving forward to achieve better health outcomes for everyone in this state.
Dr. Rogers, thank you so much for those important and foundational remarks. Now it's my pleasure to introduce tonight's moderator, Micheline Davis, Esquire, President and CEO of National Medical Fellowships and board member of the Fund for New Jersey. Welcome, Micheline.
Thank you for that kind introduction, Kiki. And thank you, Dr. Rogers, for that absolutely incredible presentation. It is my absolute pleasure to be at exactly right here with every single one of you who is joining us this evening. As we continue the Imagine More Racial Justice Begins With Us event series, and honestly to moderate this urgent discussion on ensuring access to culturally competent, high quality healthcare for everyone in the state of New Jersey. So we have a great deal to cover this evening. And indeed, Dr. Rogers dropped a lot of information for us to absorb. So without further ado, let's get to it. I'd love to be able to introduce you to our outstanding panelists. We are super excited that you've had the opportunity to already just meet Dr. Denise Rogers. In addition to her role as Vice Chancellor for Interprofessional Programs at Rutgers Biomedical and Health Sciences, she is also the RBHS Chair in Interprofessional Education at Rutgers Robert Wood Johnson Medical School, where she is a professor in the Department of Family Medicine and Community Health. Thank you for joining us, Dr. Rogers, and providing critical context to our conversation. I'm also super excited that we have Dr. Jessely De La Cruz. Dr. De La Cruz is a doctoral level licensed clinical social worker with over a decade of experience as a bilingual mental health provider. She is also the executive director of the Latino Action Network Foundation, an organization established with the goal of uniting New Jersey's diverse Latino communities and advancing their economic and social empowerment through outreach, research, and finally, policy development. Welcome, Dr. De La Cruz. We are excited to hear your comments tonight. We also have the delightful opportunity to introduce to some and present to others, Jay Wilson, founder and CEO of Melanated Moms, a community-centered women's organization that is an empowerment social enterprise supporting moms and women to become better versions of themselves through advocacy, education, awareness, and entrepreneurship. So thank you for being here as well. Rounding out tonight's panel is Maria Lopez Nunez. She is Deputy Director of one of my favorite organizations, Deputy Director of Organizing and Advocacy for the Ironbound Community Corporation, and she is also a member of the White House Environmental Justice Advisory Council established by President Biden. Her work at Ironbound Community Corporation with the White House Environmental Justice Advisory Council is laser focused on advocating and organizing for concrete policy solutions to advance environmental justice, something that impacts and affects us all and impacts and affects our health outcomes. So with that, I am going to turn to our fantastic and absolutely incredible panelists and begin this dialogue. I invite you to begin using the chat and ensuring that we are capturing those questions that undoubtedly the information that they're going to share is going to elicit from you. So I turn to each one of my panelists and I ask you, can you elaborate on one issue or law that contributes to health disparities, especially in your area of expertise, and one policy solution that we can embrace around it? So I'm actually going to begin first because I see Maria nodding her head with Maria.
Thank you. Thank you so much. And I'm honored to be on such a distinguished panel dealing with such an important topic, right? I think when we think about environment, we're not always about health. We're not always thinking about our environment, right? We're thinking about the hospitals and the food we eat. All of this is predicated by the world that we live in. Well, I would say one thing that's holding us back is racist zoning laws. So many of our zoning laws, and zoning is where how things get put where, right? Where the power plants go, where the highways go, where the public housing, where's the food, the supermarkets. And our zoning laws in this country have a history of being particularly discriminatory towards Black folks, right? With redlining, which was you can't lend here, you can't come here. And that in Newark really plays itself out. So then we have a place where we concentrated all the warehouses, all the power plants, all the things that cause us harm. So before babies are even born, their moms are breathing in air that's going to make them unhealthy. So I would say that's definitely a policy that we need to change.
That's fantastic. That's fantastic. Thank you so much. Dr. De La Cruz.
Yeah, I guess for with mental health, it can be very complex. I think the biggest issue facing mental health care is that it's too often considered a secondary or a luxury healthcare service. But mental health and healthcare are one and the same. There are decades of research that show how emotional experiences that go unaddressed, untreated, or validated by a loved one, a family system, or a community system can compound themselves into chronic medical conditions like heart disease and diabetes, and that this costs us more long term. And it can drastically affect mortality and the quality of life. So because we don't prioritize mental health treatment, we have other systems that become the front lines of mental health emergencies, like our criminal justice system, our juvenile justice system, child welfare agencies, and we wait until things are at their worst for intervention. I would say that one of the biggest initiatives to help combat, I would also, because of this, unresolved trauma is actually our largest healthcare cost, right? This is what we spend the most money on. So one of the ways that we can combat this is the 988 initiative that is being rolled out in New Jersey that would provide community-based intervention and limit police intervention for when people are experiencing a mental health emergency.
Fantastic. Thank you, Dr. De La Cruz. Ms. Wilson, please.
Thank you. Again, thank you so much for allowing me to be a part of such an amazing panel. So for me, I think one of the clear-cut things that we really need to address in terms of laws is how maternal health is actually accessed, as well as how the data is being processed to follow moms, women, and birthing people throughout the birthing process, as well as through the phases of conception. There are a lot of gaps in terms of, especially in the state of New Jersey, where access to certain hospitals, birthing centers are very limited. I know even from my own experience, being a birthing person, in my own journey, I had to cross counties to be able to get adequate care. And when it comes to a lot of birthing people, that's not always an option, right? So if we're looking at Newark, for example, there are several birthing hospitals there. However, a lot of Black and other Indigenous people choose not to birth in certain hospitals because of reputation, because of their treatment, because of a lot of history of implicit bias, right? So we have to take all those things into account. And it's really awesome to know that New Jersey has been setting precedent for what maternal health should look like and how to be an innovative space to turn around our statistics, because New Jersey is one of the bottom 5 states for Black women to give birth in terms of having a positive outcome. So in order for us to change those narratives, we have to learn from them. We have to speak to the people who are experiencing them, and we have to invite them to the table to create more action steps and more equitable solutions. So, I'm really excited to be able to do that here and to learn from everyone as well. Thank you.
Thank you. Your answers are fire. I am super excited that this audience gets to hear from you. I need to turn back to you, Dr. Rogers. Dr. Rogers, what has been the impact of COVID-19 on New Jersey's already existing health disparities?
So obviously, one of the most tragic outcomes of COVID is that African Americans and Latinos have died in disproportionately high numbers compared to their white counterparts from COVID. And what has complicated this even further is the significant amount of misinformation in both communities that has left some people very hesitant to get vaccinated, for example, when we know that these vaccines are incredibly effective in preventing hospitalization and death, and they're incredibly safe. What COVID also did, though, was it really shone a brighter light on the socioeconomic disparities that exist in this country as well, and that persists to this day.
That's fantastic to be able to have the opportunity to hear directly from you about this impact, and that it's not something that has happened once, but quite frankly continues to this day. I have to turn back to you, Dr. De La Cruz. Really incredibly important, in addition to what Dr. Rogers just shared with us, super interested in how does race and racism affect mental health and well-being?
Yeah, when someone is repeatedly exposed to dehumanization, systematically cutting them off from their basic needs, like air, food, housing, medical care, employment, this can over time and under certain conditions erode someone's view of themselves, faith in the world, causing anxiety and depression. We call this race-based traumatic stress, right? This is the term that we refer to the impact of racism on mental health. With racism, systems further compound the harm, right? When we minimize or refuse to acknowledge historical trauma and how that's kind of shaped, thoughts, behaviors, and relationships among Black and Brown people. And again, because mental health is not prioritized as a primary healthcare need, you start to see treatment happening only after someone's committed a crime or needs to be hospitalized. And this is what contributes to the disproportionate representation of Black and Brown people with a diagnosis of schizophrenia, higher rates of thoughts of suicide among Black and Latino youth. The good news is that mental health organizations such as the American Psychological Association, American Psychiatric Association, and the National Association of Social Workers have released in 2021, in the wake of George Floyd, apologies for the ways in which mental health practice has contributed to structural racism. But I still think we have a lot of work to do in regards to ensuring that we are able to have a workforce initiatives, to have more mental health professionals of color, and just having more parity and access to care through different policy initiatives.
Undoubtedly so. Do we have more work to do? My goodness. So it causes me to come to you, Jay, now. Why does New Jersey, because you mentioned this, have such a high Black maternal and infant mortality rate? Why in this state?
We started the conversation with a very clear sentence, right? Racism, not just race, right? So understanding how racism plays a part in the way that people receive care, as well as how they interpret the care that they're going to receive. A lot of patients are distrustful of a system that does not include them, that they don't see themselves in, that they don't see themselves as representatives. I know it's very difficult for Black and Brown families to see medical providers who look like them or who understand their cultural or traditional backgrounds, right? But when it comes to our white counterparts, they never have this concern, right? So when it comes to Black maternal health, if you have specific needs or if you have specific questions, Black women are less likely to be listened to. They're more likely to be chastised, to be threatened, to have police call on them, to have all of these systemic things put towards their care. So would you be as forthcoming with a headache or with pains or with other things? Probably not, right? But no other race or culture has had these same explicit experiences in our healthcare system. So because of these disparities and because of these inequities, there are going to be more deaths. There are going to be more people who are experiencing a higher rate of morbidity, right? And I know that we heard earlier how education plays a part in decreasing their likelihood of having disparities. However, Black women are 2 times more likely to die or have more morbidity happen to them if they are college educated, as opposed to their white counterparts who just have an 8th grade education, right? So this is a very clear-cut statistical study that's existed for many years that shows how racism plays a part in how care is delivered. So if we're seeing this, and we constantly see this, we have data that spans 50 years, you know, you only count us when we die. What happens when we actually get to tell our story and live? You know, when are they going to count us when that is on the table?
Ooh, that's a mic drop moment. I'm sorry, but that is. Forgive me, ladies and gentlemen, but this is something that is so important to me. And so I love the fact that we are having this conversation right now. And it causes me to turn to Maria with just incredible excitement. Maria, I'm a little girl from Camden City. And so I have to ask you, how does the environment impact the health outcomes of New Jersey's most diverse communities?
Yeah, of course. I mean, in New Jersey, if you track the concentration of pollution and then the concentration of people of color, particularly Black and brown people, you'll see that they're almost a perfect match. The higher amount of pollution is the higher amount of people of color. And that is even when you control for class. That means that this is an issue about racism. When there's more Black and brown people, they're going to dump more pollution because they see, you know, and when I say they, I mean the white system, right, that benefits white folks at the moment. It does not see us as fully human. It sees us as disposable. That's why it puts factories that contribute to heart disease, cancer. You know, when I was seeing Dr. Rogers' slides about the leading causes of death, they really intersect with my work, right? Because we're fighting factories where lead, arsenic, mercury, you know, you don't have to know a lot to know those things are not things you want to breathe in, things that you don't want in the ground where your children play. So when I think about how the environment contributes to health, it's a direct correlation. We're never going to have enough doctors if we don't actually clean up we need to do both. We need to look at how we treat things and how we prevent disease, and how we prevent disease by making sure that Black and brown people have, regardless of racism, access to clean air, clean water, and healthy food. You know, that's what environmental justice is about. It's actually about racial justice. That's the distinction between us and environmentalism, right? So we have to fight racism to really improve our environment. That's just no way about it, especially in New Jersey.
You got it. Oh, this is fire. Dr. Rogers, I'm coming back to you. I got to ask you this. So why are cultural diversity and competency so important to health outcomes?
Well, I think that, you know, part of the issue is that people feel more comfortable if they are cared for by someone who is at least willing to be respectful of one's cultural beliefs and background, and is interested in learning more about your background. And so I often talk about both cultural competency as well as cultural humility, because it's very difficult to actually be competent in all cultures. It's not at all difficult to come to an encounter with a patient, I'm speaking as a physician now, with an air of humility, with a real belief that I need to learn about this person and their cultural beliefs in order to do the best job I can to provide high quality care. Because there just aren't enough Black and brown providers to care for all Black and brown people. And quite frankly, we don't want all Black and brown providers to only care for Black and brown people. We actually need to have an expectation that all providers, regardless of race, ethnicity, will be competent in caring for patients. The other thing, though, that we need to consider as well is doing a better job of empowering the public to understand how the healthcare system works. So we typically think about cultural competency in terms of doctors to patients. I'm increasingly interested in how do we better empower patients by having them understand, how's your visit organized? What should you expect? How do you best prepare for a visit? And I think we can also get some better health outcomes by doing that as well.
That insight is incredible. And it forces me to now come back to Jay in order to say, Ms. Wilson, talk to us about when you're not the physician, but you're the patient, right? What can these women, what can these people, what can we do, right? When they feel like we aren't being heard in this circumstance.
Yeah, I'm so glad you came back to me because I was going to ask, I need to jump into that. Well, first, we need to create a equitable space where patients feel comfortable to have those conversations, right? So hearing you, Dr. Rogers, and understanding, yes, patients need to understand how appointments go and all of the flow of everything. That's correct. However, it's a learning opportunity on both ends, right? So we have to have reciprocated efforts from the medical provider to listen to what the patient is saying in order to provide the care that you want them to have, right? So I'm a nurse by trade. I've been a nurse for almost 20 years prior to starting my organization. And I've always worked in community health. I've seen how marginalized healthcare has been delivered to patients across diagnoses, across sexuality, across race, ethnicity, and language, literal and figuratively. And I've seen exactly how patients will open up to the providers who listen to them and how they will say absolutely nothing to the providers who pay no attention to them, who only want to give directive as opposed to listening to what the patient's needs are. Right? It doesn't take anything away from them being a medical provider, a physician, a MP, or anything else like that to include your patient in their care. As a matter of fact, it actually makes it better to open up that conversation so that they are a part of this comprehensive healthcare system that you want them to trust you in, right? So we already know systemically this system does not include people of color. We've seen the charts and the graphs and we understood the math, right? But we have to know that that's not something that we want to continue to uphold, right? So we're looking to you, Dr. Rogers, to be that leader for us as a physician, as a woman of color, as a person that we respect, to teach the next level of physicians who are coming in, right? And help them to understand 20 years ago, 30 years, I'm not going to age you. When you first began your career, you saw all of these inequities, but you are a part of them being the change agents that we need so that tomorrow we will have less and less and less. So this is going to improve those relationships between our patients. And it's also going to help us see New Jersey be actually a healthy place for us to imagine more, pun intended, spaces, spaces for patients to exist and thrive in their life and not just survive all of these inequities that are happening. Thank you.
That plus 10. I see that Dr. De La Cruz has her hand up. So please come into this conversation.
Yes, I was just thinking about, all in terms of work, as a practitioner, as a mental health practitioner, I also spend a lot of time doing training and supervising other mental health practitioners in because our mental health system and even research and theories and ways of thinking have been so focused on the individual, right? And not so much on the system or the interpersonal relationships. A lot of our bias comes out when you're in mental health practice, right? So that's, I spend a lot of time teaching stigma, right? And how to debunk this myth about stigma. One of the most frustrating things that I hear from colleagues is, Black and Brown communities don't attend mental health services because of stigma, because it's stigmatized in their communities. When in reality, this is a myth, right? This is not true. There are no cultures that put taboos on mental health. The problem is that Black and Brown communities have been forced to rely on spiritual and cultural practices to deal with their everyday mental health needs because of structural systems. And that this is the real reason why we may not see so many people reaching out for mental health services, right? It's because of this structural way of thinking. Also another thing I hear is that, immigrants come here and they may not have had mental health services in their country. Yes, they have. There are mental health services all over the world, and people may have had interactions with mental health systems, but it may not look like what it looks like here. So just these little nuances that we don't teach really, we teach them in their culture, there is stigma. We don't teach systems have stigmatized communities. And this is why there is fear to reach out and how to train practitioners to work with clients to overcome those fears. And so that they can be part of their mental health treatment and be on par. But unfortunately, not a lot of people do this. They don't have this frame of mind because there is an integration. Unfortunately, like when I do a training, this is the first time that someone might be even thinking about mental health treatment in this way.
I'm so grateful for your work, for all of you. Let me just say that, but in particular, you know, Dr. De La Cruz, the emphasis and the impact and the importance of, I tend to utilize the term racial, right, trauma-informed care, right, so that individuals have a full understanding of the depth and breadth of the impact, quite frankly, of having to navigate racist systems on a daily basis and the weathering of racism, and then the impact on the health and well-being of individuals in our communities. It's so significant, and for a long time, that conversation was missing. So thank you for elevating that as well, especially in this form and format. I have to go to this question for all of you because all of this has been so incredibly rich. And quite frankly, we have heard so much about how the environment impacts us and affects us, and about the impact and effect of racial trauma and the need to be able to access care through a system that, quite frankly, I want to say it's been blind to us for such a long and significant period of time, i.e. there is no, right, no aggression is micro, right? We were talking about the fact that what the reality is for women who are literally exposed to the system, and what our maternal mortality rates are. And then, quite frankly, Dr. Rogers, with the overarching impact of this system and the outcomes, and then the magnification that we have from COVID. So I have to ask all of you to bring all of your expertise in answering this question. What do you think that reparations might look like for ensuring health for all in the state of New Jersey?
Can I start?
Please.
All right. So first, the reparations need to not just be financial, because we're not for sale, right? So we need to understand that our advocacy and putting it into action is really what's going to cause the change. Right. So getting more people involved and understanding what the legislative processes are and how those feed into the type of resources that we need and we have access to in the areas that we live in. Right. So we have all of this data and we understand where the biggest issues are lying around cancer, around research, around where these issues are coming up and becoming more prevalent in the healthcare needs of the community. We can identify all of these deserts, right? So let's create more legislative processes where community members can come to the table and share their stories and talk about the narratives of what it looks like to have lack in a space of milk and honey, right? We can have the types of services that everyone has across the board and create equity if we bring those voices to the table. So shameless plug, Melanated Moms has a Find Your Roar training where we teach how to put your advocacy into action through learning what your voice sounds like, right? So understanding your personal experience is actually what makes you that person who has expertise in your own life. And those experiences are what helps to drive the creation of different laws and bills to be passed, right? So we want more families and individuals to understand what those processes look like and how to reach the people who sign those things into law and know that they have reached into doing that, right? So public policy only exists because of the public. So getting them more involved, having them join our training, having them become involved in what we're doing on the state level as well as on the federal level, understanding which laws currently exist, which things need to be revised, which things need to have more inclusion and more inclusive spaces to include all of race, ethnicity, culture, language, gender identity expression to be in the language of these laws. That's what we absolutely need at the table.
We better talk about your SOGI data.
Yes, ma'am.
All right. So I love it, Maria. I'm coming to you, and just like Ms. Wilson just did. In addition to what can reparation look like for ensuring health for all in New Jersey, I want you to also answer how our audience can get involved in advancing equitable health outcomes in this state.
I mean, this is also so very powerful. And I would say, like, for reparations, absolutely we need financial. And I would say that reparations looks like shifting power, because at the end of the day, if we're going to really transform the system and not just keep putting band-aids on it, we need to shift power. And there needs to be an equitable representation of Black and Brown folks everywhere where there's power. Because one thing that environmental justice has taught me is that systems analysis. We can't keep looking at things through the personal lens. We have to get bigger. We have to change the whole system and the way the system treats people, and people make up systems, right? Like, we got to just keep following the threads, because I want more folks like Dr. Rogers, like Jay. I want them in charge, right? I want people who are the most affected to be the ones that make decisions. And that's all about self-determination, and environmental justice. We're always fighting for how do communities decide what gets to go in our communities and what doesn't. And that, so to do that, I would say definitely there's a website, we'll put it up. It's Stop Dumping on Newark, right? And that's because we're always fighting something new, whether it's a sludge plant or a power plant. Folks just want to keep dumping on Newark. So together, I think in anywhere you are, there's probably a local group working. I think anything you care about, that you're passionate about, it's not just about the environment or health. We need to fight racism everywhere, because racism has become embedded into every single system that we care about. And so if you care about the environment, if you care about health, we have to fight racism, everything. When it comes down to it, all our causes have been tainted, right? Poisoned by racism. So fighting racism is really the way, and we can't do that without shifting power. Thank you.
You got it. Absolutely. Dr. De La Cruz, I'm coming right to you with it.
Yeah, I guess this is a big wish question, so I'm going to answer it with a big wish. It would be to really kind of decolonialize everything about the way we educate and train mental health practitioners, and teach and research mental health practice. I think that we would want to actually put a considered amount of money to look at ways that we can bridge the gap in terms of provider care. I think only like 11% of mental health providers are people of color across the state. This is very little, and then we'd actually need to re-envision what healing looks like, right? And what mental health practice looks like, and not just thinking about talk therapy, but looking at ways to have community programs. And trauma is healed in the body. It's stored in the body, so you have to heal it in the body. And too much of what we do is kind of diagnosing and labeling, and we really have to think outside the box in terms of like what mental health treatment looks like.
Fantastic. And Dr. Rogers, bring us home.
So I have to say, I want to take a step back actually before we even get to reparations. And as we have a conference or a conversation that's framed in Imagine More, one of the things we really need to talk about is a guaranteed minimum income for everybody, regardless of race, ethnicity. Because poverty is bad for you no matter what your race, ethnicity is. To be poor in America is to be in poor health in America. Everybody knows that. And so let's just take that as the first step to say that we're going to give people in this country enough money to make sure that they can have adequate housing and that they can have enough to eat. And then we can talk about what people who have historically been discriminated against should get on top of that, related to the horrific history that some in this country now want to completely deny. One of those things is we do want to put more resources into Black, Brown, and certainly when we talk about reparations, we can't forget Native American communities. And we have to talk about putting resources in for housing, for home ownership. Let's talk about what builds wealth in America, home ownership. Let's talk about putting more resources into schools, specifically so that we can make up for these huge resource gaps that we see. In New Jersey, schools are funded by property taxes. So who pays the most property tax? Rich communities. So who has the best schools? Rich communities. And then who has parents who put even more money into their schools? Rich communities. And so there are some very concrete things that we can do on the resource side to help to remedy some of this historical imbalance. But I do want to reiterate that for me, the most important imagining that I want to make sure that we start to not only imagine, but do, is we need to eliminate poverty in the richest country on the face of the earth.
That is yet another mic drop moment for you. I am delighted and honored, quite frankly, that the panelists have been so kind as to answer my questions. But I now like to open up to the floor of our audience. Please, audience, use the Q&A feature to ask our panelists your questions. And while you do that, we'll start with audience questions that have been submitted during registration. Actually, I see one that is right here, right now, and that is, how can we begin to shift mindsets to view health and healthcare as a right and not a privilege?
You know, it's interesting. This is something that we've been talking about. So, Jay, I appreciate your not wanting to age me, but my gray hair kind of does. And we have been talking about healthcare as a right for 50 years. We allow ourselves to get distracted by false arguments that are often made by people in the insurance industry, who say, oh my goodness, if we have universal access to healthcare, it'll be lower quality and blah, blah, blah. Well, let me tell you something. All of the countries, literally all of the countries that have universal access to healthcare, particularly those in Western Europe and those Canada, Great Britain, they all have phenomenally better health outcomes than we do. Now, do they still have disparity? Yes. So it doesn't solve the racism problem, but certainly it's a big step in the right direction. And we need to not allow ourselves to be distracted every time we start to make some movement. Obamacare was a wonderful thing, and we need to acknowledge that and understand that and say our work now is to take it to where it should have been in the first place, which is universal access for everybody.
That's it. Come on to our other panelists. Feel free to jump in here. Who has another question about that or another answer?
I would just say, I absolutely, Dr. Rogers, this is absolutely true. You know, expanding universal coverage to everyone, regardless of their immigration status. This is very, very, very important. You know, I saw firsthand as a practitioner before ACA was passed, how you could not have access to medication after a hospitalization. Even if you had Social Security income, you had to wait 2 years. They had all these rules of before and but, and if under these circumstances, age, all these things. And right away, you know, you saw people being able to be stabilized. So if we were to expand that even more, you would see a much more stable economy, workforce, everybody, you know, it would result in better health, more access to preventive care instead of waiting, you know, for emergencies. That would be definitely would have to be part of our reparations.
Thank you to our doctors. I've got one here from Thomas Cook, who is watching us right now and participating. He literally wants to know, do the panelists consider improved Medicare for all an important initiative to resolve health disparities? Any takers?
Yeah, I mean, obviously, I've been part of Physicians for a National Health Program for decades, and whatever you want to call it, Medicare for all, universal health care, single payer, there's no question that giving people better access to care is an incredibly important component to helping to eliminate health disparities. It's important, but it's not enough. And I think we can't allow ourselves to believe that just by doing that, we will solve this problem. But it's a very important component.
Incredible.
You know, I'm sorry, I'm just jumping in here now. Dr.
No,
Rogers,
come on. Listen, we're all at the same table.
It's so true. You know, the issue is that so many of these issues are interlocking. You know, you're always going to hear me talking about funding for BIPOC mental health professionals. This is a big initiative of mine. But the problem is that we could fund that. And if we don't desegregate New Jersey schools, we're still going to have huge educational equity gaps in finding a workforce. And if we don't acknowledge someone's past education and professional experience in their country of origin, because of our systems that we prioritize as more important or structured or whatever it is, then again, we're going to have difficulty finding people to hire for all these positions and internships that we fund. So we need to also desegregate New Jersey schools, provide universal health coverage. All these kind of initiatives would be really important.
I think that is absolutely accurate. I've got another fantastic one from Teresa Pringle. So I'm gonna send this out there as well. So Teresa writes, I've observed through outreach and engagement, young people of color ages 18 to 24 are falling through the healthcare system, specifically with respect to substance use disorder. Is there any agency that might be addressing this proactively? Dr. De La Cruz?
So yeah, definitely. I would say definitely the Division of Mental Health and Addiction Services is currently rolling out 2 initiatives aside from the 988 initiative. This is huge. I mean, this will prevent police intervention. People with mental health crises frequently can die when interacting with the police because of, just not understanding and navigating their symptoms. And there's also initiatives in terms of like an Atlas app and just a lot of money coming through the American Rescue Plans in terms of funding substance abuse services, prevention services, screening in schools. All these initiatives are currently going on, and you can follow the Land Foundation for more information on that on our website.
That's fantastic. Maria, I've got one that's directly for you from an audience member. I'm so sorry, Jay. Please.
Yeah, sorry. So there is actually an upcoming conference from the New Jersey Prevention Network on June 23rd and 24th, where they're actually going to be addressing what does it look like to talk about substance abuse and creating more channels so people have the support that they need. So I just want to make sure to share that.
I deeply appreciate it, and I'm certain that everyone else does as well. Maria, I'm coming back to you. We've got a question from Valeria. She said, I am with Voices for Health Justice. I recently read your article, Stop Polluting the Ironbound. We are currently writing letters about this to Senator Cory Booker. What other suggestions do you recommend to get attention from other politicians to move the mission forward?
Yeah, excellent question. I think it's important for all of us, regardless again of our issue. When it comes to politicians, we have to write to them, but we also have to show up at their jobs, right? Like I always like to say, you wouldn't hire someone and then never check in on them. Or if the teacher showed up with you at school, but then he checked in with you until the end of the school year, I wonder what we learn and what we get done. So with politicians, I say, let's show up and make sure that they know that we're paying attention. That means showing up to, if that's a town hall, or showing up to a city council meeting, know who your city council people are, know who your mayor is. I think democracy is only in practice. We talk about democracy a lot, but we don't do it. Like at home, mom's in charge, at work, the boss is in charge. And democracy really requires active, like participation. We have to get in there and talk about our issues and talk about them everywhere where politicians are listening, because I like to think that politicians can be humble and they learn a lot because they learn from us, the communities, when we're talking to them, when we tell them what we care about, our experiences, what we've seen in our families. Like at the end of the day, I think we're human, right? And so we need that human to human interaction. We can't just be on Twitter all the time. We have to show up and really speak up about our issues. I think that really changes things. I've seen the power, that's what Ironbound's all about. It's people power, whether it's environmental justice or housing justice. All of these things are connected. And I think that's another thing, is being in solidarity with other people's communities, because we're all connected, right? So your liberation is tied to my liberation. So when I show up for you and you show up for me, I think and maybe I'm naive, but I really think that makes a big difference, and that's how we spread the love around.
Speak more to that. Jay, hop in here. This is good. I don't know about the rest of you, but I'm having a good time. Jay, speak to that.
Sorry. So you're right. Like we need to have more spaces that are inclusive. This is one of the biggest reasons why we exist, right? So understanding how we can all incorporate into each other's mission and vision. This is how we create better opportunities. This is how we also take away that stress of having so much on your shoulders, right? Like we don't want to be burned out as the only resources, right? So I love to say, find a resource and be a resource. So we're finding one another in this panel, and we're finding the ways that we can support one another, but then we're also becoming even stronger resources for people to be able to depend on us, right? So we just need to continue to have that same energy, right? And just like you said, going to talk to the senator, going to talk to the people who are creating these spaces, creating these laws, creating more resources for people to tap into, we need to hold them accountable, so making sure that even if these things are created and signed and sealed and delivered, they're actually being disseminated to the people who really need them, right? And when they don't show up in the communities that they said that they would, hold those people accountable, right? Why are you still representing me in office if I can't access this resource, or if it takes me 10,000 years to apply for this resource, or I have to be on a waiting list for 2 years before I can see $1 of this help? How helpful is this really going to be for me? How helpful is it going to be for the communities who really look to us as resources? So us being able to be a collective as opposed to competitors, we're able to change the narrative of what all of these issues are, and we're creating a better tomorrow for our children so they can see legacy instead of limitations.
Jay Wilson for president. I'm so sorry. It just comes out. Dr. Rogers, please.
I have to pick up on what Jay said. I'm so much in agreement.
Oh,
but
thank you.
You missed a key word.
Oh,
we have to vote.
Yes.
People have to vote. And you have to vote. Everybody comes out for the presidential elections. And don't get me wrong. What we see clearly with what's going on in this country right now is that is incredibly important. But you know what? You got to show up for the school board election.
That's right.
You have to show up for the mayor's election. You have to show up for the state legislature and the governor. People need to vote. And, I will say, as an African American, I am particularly appalled by people who don't vote, because there are people who came before us who died in order for me to have the right to vote. And we disrespect our ancestors by not picking up that mantle. So everybody may not be able to come out and march. Everybody may not be able to make it their life's work to help to change the world. But everybody can figure out how to vote.
Mm-hmm.
I often said that the number one most important action that you can take for your health is to vote. So I love everything that I'm hearing right now. Ladies and gentlemen in the audience, I don't know about you, but I could be here. This is everything right now. We have another question. We're getting lots of questions from our audience. They're very excited about this. And so I'm going to ask you something from Kathy White. Kathy asks us, what current legislation is before the governor to link services in the entire state? Is there a task force on these issues? And if not, do we know why not?
I can speak from the maternal health space. So Nurture New Jersey has been an amazing initiative since 2018. We've been a part of it since 2018, and we've seen so many amazing strides. I'm also a part of the Maternal Care Quality Collaborative, where we're actually, again, holding more spaces accountable for creating quality measures around what maternal health looks like in the state for Black women, but for all, right? So understanding that our governor has not only taken initiative for improving specifically Black maternal health, and then seeing how that overall helps and feeds into maternal health as a whole. He's also taken another step forward, which I just found out, where he's leading other governors throughout other states to take the same initiative. So we are seeing how New Jersey is actually being an integrative space and changing what it looks like for governors to hold others accountable and saying, like, we're not going to continue to be in the bottom. Here's how we're going to do it together, right? And that's really important, especially how we're positioned. New Jersey is a little big state, right? So we see how many people come from New York, from Philly, from Delaware, from even Maryland, right? Where people are utilizing care that we have here because it is so innovative. We need to learn from all of the states that are around us, right? Patients are coming here for different types of care or leaving and going to other places for different type of care. We need to have an integrated approach to support one another, and we'll see the mortality rates improve by having those more communicative conversations, right? And this is important, right? We need to learn from one another. We cannot continue to work in silos. That's all I have to say on that.
Look, that's all. My
I can go on, but that's
everybody is dropping dimes here tonight. We have so many good questions. Forgive me, it's making my head hurt. I like this one in particular. So this one's from Crystal Charlie Sibley. what type of accountability measures do you think would deter medical providers who, and this is her terminology, who integrate racism in their care or lack thereof? How do we hold those systems accountable? Is essentially what she's saying. And how do we really make certain that they change? Dr. Rogers, I see you're off mute.
Yeah, I'm off mute. It is an incredibly complicated question.
Yes.
And I think, to be honest with you, while I'm somewhat interested in holding people accountable for being racist, what I'm much more interested in is holding people accountable for delivering poor quality care. And I think that some of the components of Obamacare that have sort of been delayed for a variety of reasons that really looked at paper performance, so that you really, if I am not able to manage my patient's blood pressure sufficiently, then I should be penalized financially. And one of the most important components of that, though, is I should be forced to look at my data by race ethnicity. So, because if I look at it in aggregate, it may be that, 80% of my patients are white and I do a great job of managing their blood pressure, but for that, 10% of patients who are African American and 10 who are Latino, I don't do as well, but my data looks good because it all gets aggregated together. What we really want to do is to force providers and systems to look at the data by race ethnicity, and I will tell you, it's been my experience that healthcare providers are very motivated by money, and the extent to which I am financially penalized for doing a bad job is the extent to which I will be motivated to do a better job. And at the end of the day, what matters is really health outcomes. We want African Americans not dying at younger ages, and we want the infant mortality rate, the gap to be eliminated. And so our work, it's just too hard to reach into people's minds and figure out when they're acting out of racism. It's not that hard to hold people accountable for the outcomes and the quality of care that they provide.
Dr. Rogers, that's exactly right. The thing that I was going to say with literally, we need to tie it to their reimbursement. We need to tie it to, right, that their patient satisfaction scores. We have to make certain that equity is actually an element of their quality measure, right? There is no quality without equity, right? And so unlike some senators would say that in other parts of the country, that our maternal mortality numbers are fine if you just take out Black women. Well, you don't get to take us out, right? Because you're the reason why we're dying. Here's a really great one from Jeff Vega, especially for all my folks who have been involved in community work. I like the promotor model, where people reach out to where people live to engage them in community health initiatives. What other successful models do you suggest?
So I'll jump in here when it comes to mental health. Yeah, when it comes to mental health, definitely the promotora model. This is something that we're actually looking to integrate with our Hispanic Women's Resource Centers, and able to provide just, peer-to-peer, like mental health first aid and education. I think some of it is just teaching people like how to manage their feelings. These are some soft skills that, we don't have to give people like a million licenses for and have them go through 10 years of school like I did to do that. I think we can teach peer-to-peer models to talk about mental health and to teach community members about mental health. Also, aside from promotora programs, the research and resilience and when it comes to trauma and adversity there's studies that show that when you actually promote someone's, when parents who promote their child's healthy view of their ethnic identity, right? So that they're able to, that is actually buffering from adversity and trauma. They will be better able to manage when they encounter discrimination if they have a healthy view of their own ethnic identity. So actually, if we were to do mental health programs that included more like drum circles circles, or cultural practices that have to do with the body and talking circles, this would be a great community-based mental health program. And I know that there are several programs that do this across the state, you know, and another excellent approach is the anti-violence program movement. You know, this is excellent work, excellent first frontline mental health treatment and services for communities of color. This is what I was talking about, just not looking at mental health agencies and systems, but really thinking about how mental health is such a part of everything that we do, and how do we fund that in communities, out of churches, you know, peer to peer. That's really, we need to build the workforce, not just by having people go to millions of schools and get 1,000 licenses, but also just integrating mental health into our everyday conversations. So those would be great.
Absolutely. Absolutely. I saw Dr. Rogers, please.
Yeah, let me just add one thing really quickly, and I think this is relevant actually for the mental health side. I think it's also particularly relevant actually for women's health, which is we need to find ways to better incorporate mindfulness and exercise into people's lives. They have been shown to be incredibly effective at dealing with both trauma and stress. Do they replace mental health services when people really need them? Absolutely not. But are they ways to help people build resilience? Absolutely. And so we need to talk more openly about mindfulness, and we need to find ways that people can successfully and safely exercise.
Fantastic. Maria.
Yeah, and you know, I'm hearing y'all use the word resilience, right? And I know you're using it in a slightly different context, but I think it connects perfectly, because as we're facing climate change, everything's gonna get worse, right? Like people's mental health is gonna get worse. You know, just thinking about flooding. And flooding, I know we live in New Jersey and we think it's not affecting us, but New Jersey is actually gonna have the most rain. And so flooding is gonna become an issue. And then that intersects with housing, because if you live in a basement apartment, in an apartment that has mold in it, right, that's going to impact your health. That's going to impact all the outcomes. So when I think of all these things, like I said, they're all connected. And for us at Ironbound, it's about neighbor to neighbor. If we know who our neighbors are, we know who's the senior citizen who maybe we should check on if the electricity went out because they're on an oxygen machine, right? We know who's about to give birth, and we keep checking on them, bringing them food. And I think during COVID, we saw how our communities had to be there for each other, mutual aid and support, right? How we had to check in on our family members and friends. So you know, like I said, naive, but get to know your neighbors, build that community, that sense of cohesion, of connection, and that you're not by yourself, because I think that helps us with mental health, but that also helps us organize. You know, like at the end of the day, I think we need to organize to build power, and that can't happen unless we have real, authentic relationships with each other. We're not just signed up to a mailing list. We're actually know the people we're fighting for. That makes a big difference, you know?
Maria, can I just jump in real quick? This is so important, because I'm going to intersect with this mental health stuff. You know, when I work a lot with abuse and trauma survivors, and one of the biggest things that, you know, perpetrators do is that they isolate their victims so that they cannot talk to anyone about what's going on with them in order to seek help. So if you have somebody who's living in housing that their landlord won't come and have the bed bugs removed or address the mold of that, when you have this peer-to-peer support, those abuses of people are less likely to remain silent.
Yeah, no, we all have to tell our story, right? Because it helps other people tell their story.
Right.
I also I want to jump in and make sure that we don't forget doulas and how helpful and evidence-based they have been at improving maternal health and mortality rates and infant mortality rates and breastfeeding rates especially amongst Black birthing people. They have been so pivotal at changing what it looks like to have an integrated healthcare team, and they have come into the healthcare system not always welcomed, but always persistent and always consistent. So we need to definitely make sure that we do not leave out the importance of doulas and midwifery care as a part of improving maternal health.
Listen, absolutely. It's all got to be in there. It's all got to be a part of it. It's both maternal and mental health, quite frankly, right? As we are talking about this, we've got to make sure that they're all connected. When you're talking about community health workers and doulas and everyone else that we need. Listen, thank you. Unfortunately, that's all the time that we actually have for tonight's discussion. Trust me, I know. I want to go home with each one of our panelists too. But please join me in thanking our panelists. Dr. Denise Rogers, Dr. Jessely De La Cruz, Jay Wilson, and Maria Lopez Nunez. It has been such a powerful and empowering, important conversation. You have been full of actionable advice, on how to advance the movement for equity and justice, and we thank you. I want to take this opportunity to highlight some of the key points and policy recommendations made by our speakers tonight. It's really important. So that we're on the, just boot up a slide really fast. Yes, yes. So first and foremost, right, despite being among the top of the nation, New Jersey has a long way to go on health equity. We know that this movement needs participation from all of us. We've talked about it here tonight, the public sector, the private sector, nonprofits, residents, to ensure health for us all. And we know that, as our panelists mentioned, policy making is one way to address this issue. From making access to healthcare universally accessible to providing cultural competency training to medical providers and patients, we heard a number of possible policy solutions that can help address health disparities in the Garden State. If you'd like to learn more about the fight for environmental justice, we highly recommend watching The Sacrifice Known. This short documentary follows one of tonight's special speakers, Maria Lopez Nunez, as she leads a group of environmental justice fighters determined to break the cycle of historically marginalized communities of color serving as dumping grounds for our consumer society. Also, July is Black, Indigenous, Persons of Color Mental Health Month. Please visit the Latino Action Network Foundation website to learn more and register for upcoming events. Finally, my friends, get involved with one of tonight's organizations or a grassroots organization advocating for health equity in your community. I want to thank you once again for being a part of this interactive, explosively empowering discussion. And I want to give it back to Kiki Jameson. Thank you, everyone.
Wow. That was such a powerful, motivating, inspiring conversation. Thank you so much to our moderator, Micheline Davis, and to our panelists, Dr. Denise Rogers, Dr. Jessely De La Cruz, Jay Wilson, and Maria Lopez Nunez. I'd also like to recognize all of the fund's partners and co-sponsors without whom this would not be possible. I hope that you enjoyed the conversation tonight and are inspired to get involved. Early next week, you'll receive an email with resources, including all the links just put in the chat and information to help drive change in your community. In addition, we hope you will participate in the next and final installment of the Imagine More Racial Justice Begins With Us series on July 21st, when we'll talk about building political power of the most impacted. More information can be found at www.imaginemorenj.org. If you missed any of our previous events, Eliminating the Racial Wealth Gap and Ending Poverty, Disrupting the Criminal Justice System, Achieving Safe and Healthy Homes for All, and Reaching Equity in Education, you can also view them at that website. Thank you so much for joining us tonight. Have a great evening.